Why does drive TB cause social stigma? Imagine living with a disease that not only affects your health but also changes how others see you. Drug-resistant tuberculosis, or drive TB, often carries a heavy social burden beyond the physical illness. The main reason for this stigma is the fear people have about catching the disease. Many believe drive TB spreads easily through casual contact, even though it mainly spreads through prolonged inhalation of airborne bacteria. This fear leads to social distancing, isolation, and sometimes even rejection of those affected. Patients may isolate themselves to protect loved ones or to avoid judgment, which can cause feelings of loneliness and shame. Another factor is the association of drive TB with marginalized groups. Those most affected tend to be people living in poverty, prisoners, refugees, or individuals with HIV/AIDS. These groups already face discrimination, and when they develop drive TB, it can reinforce negative stereotypes. Society may wrongly see them as morally responsible for their illness or as dangerous, which deepens social exclusion. Misinformation and lack of understanding also play a big role. Many people mistakenly think TB is highly contagious through casual contact or associate it with immoral behavior or curses. Such myths create fear and lead to social rejection. In some cultures, TB is linked to witchcraft or seen as a family curse, which intensifies stigma and makes it harder for people to seek help without shame. The impact on personal relationships and social roles is profound. People with drive TB often face discrimination at work, in marriage prospects, and within their communities. Women, in particular, may be blamed for spreading the disease and suffer divorce or social isolation. Because of this, many hide their illness, delay seeking treatment, or stop therapy altogether, which can worsen their health and increase the risk of developing even more resistant forms of TB. The treatment for drive TB is longer and more complex than for regular TB. It can last from 9 to 24 months, involving multiple drugs that may cause side effects like nausea, hearing loss, or liver problems. The visible effects of treatment and side effects can make the illness more noticeable, fueling fears and stigma. Patients might worry about being judged or ostracized if others find out they are undergoing such intense therapy. Cultural and social expectations also influence stigma. In some societies, protecting family honor is very important. Patients may withdraw from social life or use less stigmatizing words to describe their illness to avoid shame. This pressure to maintain social standing can lead to secrecy and reluctance to seek help, which delays diagnosis and treatment. Overall, drive TB causes social stigma because of fears about infection, misconceptions, and the social and cultural context surrounding the disease. This stigma can lead to social isolation, discrimination, and barriers to accessing care. Addressing these issues involves improving public understanding of TB, supporting patients emotionally and medically, and developing culturally sensitive strategies to reduce fear and prejudice. It's important to remember that each person's experience is unique, and seeking advice from healthcare professionals is essential for proper diagnosis and treatment.